Fibroids or leiomyoma, they are the most common non-cancerous tumor or benign tumors which occur in the females of reproductive age from your menarche to your menopause. This pathology may appear and it is most common. So, what is it? Where does it occur? How can we diagnose it? What are the causes, symptoms, and diagnosis? We will discuss everything in this video. So, let's come towards what is a fibroid. Fibroid is basically your uterus has three layers: endometrium, myometrium, and perimetrium. In your myometrium, the smooth muscle cells and the connective tissue, they form a fibroid. It is a pathology, obviously. So, what happens is that inappropriate growth of your uterine muscle tissues or myometrium, it basically forms a fibroid. Fibroid होता क्या है? It is basically this outgrowth जो obviously अगर यहाँ पे appear होगी तो it will produce pressure effects, pressure symptoms. So, जब फाइब्रॉइड की बात आएगी, what we will see is number of fibroids कितने हैं, location उनकी कहाँ पे. According to location there are different type of fibroids. I will tell you later. What are the symptoms they are causing? Does a girl want to conceive or not? We will treat it accordingly. And there are patients who are asymptomatic with having fibroids, and there are patients who are symptomatic with having a few number of fibroids or even one fibroid. They are symptomatic. So the most common symptoms of fibroid, सबसे पहले तो according to the concept we can see that it is an outgrowth in the myometrium and it can occur in your uterus or on your uterus. According to its location there are types. Now the symptoms, the most common symptom of fibroid is heavy menstrual bleeding or irregular menstrual bleeding or postmenopausal bleeding. So a patient will appear to you with back pain, painful menstrual bleeding, pressure symptoms. Obviously it is an outgrowth, it will put pressure and produce its effect. So if it produces pressure आगे की side पे, so it will cause frequent urination, which is a major symptom of fibroid. Frequent urination, if it produces pressure backwards, it will cause constipation, irregular bowel movement, and bloating. Patient may also experience infertility, but there are some patients who are fertile, who who conceive and deliver as well having fibroid. So it does not define that the patient who is having fibroid cannot conceive. Now let's come towards the causes of fibroids. First of all, as I have told you that they respond to estrogen and progesterone. So any disease or anything in which your estrogen level increases, the chances of your fibroid growth will also increase. Early menarche, late menopause, nulliparity is having no children at all, genetics, and your body weight. These are all the causes of fibroids, and first of all, the pathogenesis and the causes of fibroids are not exactly known, so we cannot pinpoint out that these are exactly the reasons that your fibroid is occurring or not, but they are some of the causes that we know. And many people are concerned that does pregnancy occurs with fibroids or not. Yes, pregnancy do occur with fibroids, but it depends what kind of fibroid it is. A patient may conceive with fibroids, have a normal pregnancy for 9 months and deliver, but a similar patient or a different patient can also experience that another fibroid occurs with, that is intramural. It depends on the location of the fibroid. The intramural fibroid or the fibroid which is into the cavity of the uterus, it might lead to infertility, or it might cause abnormal contractions during your pregnancy, recurrent abortions, difficulty in implantation, or difficulty in conceiving. So it depends on the location of the fibroids. Now one more question is that are the fibroids treatable or not? Fibroids are 100% treatable.